positive during their work and they have recovered well. So today we are going to have an interactive session to assess and to access their journey of life through their tough days, how it was different mentally and emotionally when compared to the normal people. I'll take this opportunity to welcome you, doctors, for our session and back to the profession.
Namaste, sir.
Namaste. Namaste. Sir, today we're going to have few question and answer or an interactive session we can call it as to assess to access your journey. So Vijay sir, for you for the first question, like how was your approach or your routine work even this COVID era before you got COVID-19 positive?
Yes, sir. Even before the COVID era also, I am being an ENT specialist and ENT surgeon, we really routinely examine nose, mouth and ear. We take all the precautions by wearing mask and routine surgical mask. And after this pandemic has been announced and by the concerned authorities, we took extra care of adding an N95 mask over the regular surgical mask. That was first of all, and routine basic examinations we were not doing. Suppose a patient comes with a throat pain or something like that, we are not going to use the examination part. Only the history used to ask it through the prescription. But when you wanted to do a routine endoscopic procedure, whenever it is called as a aerosogenerative procedure, we used to ask the patient to get a test done. Test done means if it is fully symptomatic and he needs an endoscopic examination, we definitely required a COVID test to be done. If it is negative, we could do it as a routine procedure. If it is positive, we could have asked the patient to become negative and then do a procedure. But nowadays, with the malignancies being a major concern for the ENT, with the airway obstruction, patient coming in airway distress, we could do procedures like emergency procedures like a tracheostomy or intubation, wearing the PPE in COVID OTO. But approach is definitely the prescribed protocol by the concerned.
Dr. Bharti, how was your scheduled work in terms of how was your approach when the COVID was there and you are going to see the patients? What are mentally things are running? Like how was your approach towards a patient? Because you will be also having the patient who will be COVID positive also. Like how the mental things are running?
Okay, sir. Initially, from the period of lockdown, we used to work all the precautions. As Vijay told, we used to take all the precautions and we used to see the patients. But even though in 16 years of my experience, we had a lot of difficult situation more than COVID. But this time, in my mind, there was little, as a professionalist, I was shaken because every patient was seen with a suspicion, oh, this may be a COVID positive. Even though we have taken all the precautions, wearing PPE, all those things, but still that was what I was going through.
Dr. Vijay,
yes, sir.
what was you were running in your mind when you are going to give the swab for COVID? You thought, okay, I have to get tested. How was your? Are you tense? Are you relaxed? What are things are running?
Sir, I didn't get the test on myself only because initially I developed symptoms like common cold.
Okay.
It started with running nose, sneezing, throat pain, and mild body pain and a little bit of fever, 1 or 2 days. I waited for a few days. That is, I didn't had a corona in my mind, COVID in my mind. I thought it's just like a common cold and it will go in some 3-4 days. That's what in my thinking was. First 3-4 days, initially the symptoms didn't completely go because the initially common cold means by 3 days, 4 days, maximum 5 days, the symptoms will be disappearing and you will have some nasal congestion or nasal stuffiness you may be having. But this time after 5 days also, I didn't symptoms didn't improve completely. So then my mind started thinking it could be corona. So I started then bit separating my with family, and after few days consulting with my seniors, I thought of getting tested, and in the mind, in the meantime, the symptoms appear to be good, little bit worrisome. Cough started, and a little bit of breathlessness also started. Then I thought of consulting doctors and consulting our physician. When I consulted my hospital physicians, they advised me admission. Then I got admitted, and the next day I got the test done. Though my mind was clear that it could be COVID due to the symptomatic part, I was not worried much. But when the respiratory symptoms started, I was a bit worried because of the complications what I have heard they heard in through the social media platform. And while doing this, it's nothing, just like routine test being done.
So it's a social media or the TV has contributed for the
Definitely, sir. Especially, I would tell in situations the TV is news media is definitely uh, what you should say is threatening people. Just like I think that's the better word. Threatening only the word should be used because whatever the graphics you use, whatever the images of the virus, what's being used in social media definitely threatens the people. Because I know and you know, being doctors, what the virus looks like and how it appears normally. But with the imaging, with colors and glorifying music in the background, if you tell this message to people, they will definitely get threatened. That's
media has threatened the corona, media has threatened the public, media has threatened the doctors. So media has done all threatening ways. Okay. Dr. Bharti, you were given the swab and you are awaiting for the results. Like what are the things are running in your mind? Like how as you are internally? Are you peaceful or how you are?
Okay, I was actually not worried much about myself. Just because one of my staff member came positive, routinely I just went along with all other people and I gave the swab. But I just before that, 2 days before, I attended one of my very close family function, but with all the precautions of wearing mask, all those things. So only that I was running in my mind.
How you take the result when you found it as positive? Like shocked?
Yeah, yes, sir. I was really shocked because absolutely I didn't have even symptoms. Even after came positive, also even till now there is no symptoms for me. So I was very confident that my test will come positive, will come negative. So I was really shocked to hear positive statements.
So you didn't want it to become positive. So as like routine this one, but you had a fear. That fear made you to like it should not be positive, right?
Yes, yes.
Sir,
yes, sir.
You become admitted to the hospital. You went there and you got admitted, got test.
Yes,
so with respect to just before getting admission, with respect to the availability of bed, treatment, about the food and hygiene, are you worried?
No, sir. Because I was being referred to some one of the good private hospitals in the Bangalore. That's the first thing. And before I was sent, the bed availability was confirmed by my seniors and my colleagues. And I should actually thank them. The situation not worse as of now. In that time, when I got I think in the June last weeks of somewhere. And the situation is not worse, and the beds were available in every private hospital and every government hospital. Since beds were not available in my hospital, I was referred to some private hospital, and there they took care of me very well. And one says the quality of the care being provided in any private or government hospital will be good only when considered the COVID zone. Because you should think of the COVID warriors who are working there in full PPE, working for 6 hours continuously. It's not an easy job.
Sir, you got admission and your COVID came positive.
Yes,
Like, how was your experience? Like about oneself or about like family, because you'll be away from the family. Even though because before admission you'll be there in the home quarantine, you would have
yes,
been there.
yes,
But like being in the hospital without any family support, what we can, because they'll not be with us, so we'll
yes.
be deprived from the family or relations, or any problems like mental or emotional challenges
Yes,
you
sir.
felt.
Yes, sir. Yes, sir. That thing I would tell you, because initially first 2 days before the test results came positive, I was kept in a separate room, single room. I was kept, and I was not allowed to meet anyone. That 2 days were very hard for me, very difficult for me to pass on. But after the test results came, I was shifted to a ward like 6 or 10 patients were there, and where you can see people. See, being a human being, you need to meet people, you need to interact with them. Then only the mind will be clear that you are in the society, or you are somewhere in the on the earth. Otherwise, you will feel that you are alienated. So after the test results came positive, I was shifted to some other ward where I was inside. There were some five, 6 more patients. There was a boy, 18-year-old boy, who had met with an RTA, and without anything, he got positive. And one more boy who was pre-op, he got tested and he came positive. They both were asymptomatic, and I could interact with them. I could use my experience to at least allegiance, and I had that had opportunity. And even through since the use of the mobile phone is allowed there, I was able to make calls with my family. I had video calls with my family and my parents, and that was best part of the stuff. Though you were feeling that the family, you are being away from the family, it's difficult for them to get the things done at the home, because my 2 kids are also small. Wife cannot leave them and go out to get some whatever. In this time, my friends and my colleagues from the hospital, they helped me a lot, sir. I should thank them all for their prayers and for the support they gave me during my admission time in the hospital, sir.
Okay, thank you, sir. Dr. Bharti, after your test came positive, you would have been there in home quarantine because you were asymptomatic. So, is there anything which has changed within you, like the state of mind in your, and how the positive result of a COVID has affected your life?
Okay, sir. Actually, when I got this COVID positivity, there was no option for home isolation initially. So I was hospitalized with almost for 5 days. Well, of course, I was taken care by my staff very well. As Dr. Vijay told, I was also undergoing lot of. There was also, because I was asymptomatic, I was little bit worried because symptomatic patients were also there in the ward. So, as a doctor, we will always be thinking about most of the complications rather than simple things. But during that period, I got an option to interact with Unity Healing Foundation. So they supported me a lot. I attended very few sessions of them where they taught me these meditations, prayers, and lifestyle modifications. Of course, we are aware of it, but that gave me an opportunity to do the practice. Of course, I was also practicing before also, so that gave me the strength to come out of my situations. After coming to home, also, even simple things like waste management was a big challenge because I was not aware of whom to contact, all those things. So then my colleagues helped me, and then I called to the BBMP people and us in that scenario. Managing waste management is also, especially during home isolation. Apart from this, I came across before I got the test positive. I was in association with Unnati for a long time. So one of the COVID patient from US who couldn't access for the normal medical services there, they approached. So they underwent the healing session and the lifestyle modifications and meditations, all those things. With that, they came out. That was one part of it. And second, recently I also took, so once I came out of this COVID, I also took the relaxing options through Unnati for COVID patients. So one of the patients who was almost with a oxygen and he was in the ward. So he was actually not able to express himself that time. But after 2 hours of session, he really came out and he told, "Thank you so much, ma'am, for this session," because he was able to sit properly and he was able to breathe and he was walk around. He had a lot of gratitude. So, such kinds of sessions really going to help not only the patients, even the COVID warriors. And apart from this, after my positivity, my students also came positive and they were also admitted to the patient, admitted to our ward. And they also exposed to this Unnati healing sessions and they felt very happy. That is what I wanted to share, Dr. Sharat.
So you mean to say in your journey of COVID, your the healing sessions, relaxation sessions, meditations, and helping others will had a major role in handling the COVID stress.
Yes, definitely.
How are you feeling at the time of discharge? Okay, now told you can go back to home. Like, how was your feeling after going through the COVID stress in the hospital?
I was really very happy to go home, though I have to be there for home isolation. Um, that was a real good feeling.
Dr. Vijay,
Yes, sir.
because
Meeting the family.
because you had a symptoms, you got admitted to hospital, then the report got positive. So how was your feeling at the time of discharge? Like you are going to meet your family.
Yes, sir. Yes, sir. And I am. It's the first time in the last few almost 10 years. I was kept away by the family almost for more than 10, 12 days. Uh, what happens is the meeting the family after discharge was an emotional one, and I couldn't control my emotions while meeting the family. Though initially after entering the house, I had to clean up everything. Then only I met them personally. It was very emotional situation that I couldn't forget couldn't forget it for my lifetime. So that's the best part. And moreover, the support I got through my wife and friends, that was most encouraging part of the healing sessions. And after coming out of the hospital, he guided me to this Unnati Healing Foundation, and I was keenly following all the sessions, and that also definitely helped me come out of this stress emotionally and also more physically also.
Dr. Bharti, how was your approach? Okay, before COVID, you were seeing the patient, you are mentally like you are fit, you are firm, like you will be able to like do even the during the corona time, you are able to see the patients with confidence. But after your test came positive, so you were slightly nervous. Then you are going now after complete recovery, you are going back to your work. Now, how you are feeling? What is your approach as a corona stress is concerned?
The corona stress, yes, the cases were increasing in our hospital, and our hospital was also designated to be a COVID positive hospital. So, because I have underwent all those sessions, there's a lot of positive approach in dealing with the patients, and even I will talk to the patients very positively. It's another viral disease, that's all. So, as Dr. Vijay told initially, it's like any other cold and cough. So, don't be panicked, but at the same time, you have to be careful. Take the help of proper physical hygiene, emotional and mental hygiene through proper positive practices like yoga, pranayama, um, healing sessions, and also taking care of yourself, of course. Through that, you support family. That is the most important challenge you will undergo as a COVID positive patient or COVID positive warrior, whatever it is. So, supporting the family in a positive way is one of the responsibility and that is what I did it, and also I'm continue to do these things as of now.
Dr. Vijay,
Yes, sir.
like you were priorly seeing the patients with the mm, patients who are there, like we don't know whether they are COVID or not.
Yes, sir.
Now, after you turned to be COVID positive and came out, recovered everything, now you are again going to see the same patients.
Yes, sir.
Again, we don't know whether they are positive or negative. How was your approach priorly and how is the approach now?
And not much difference, sir. I'm taking little bit extra care by wearing an face shield extra. Before I used to get one surgical mask and N95 mask. Now above that I will be wearing a face shield extra. And moreover, you cannot prevent the virus coming to you by putting anything over your heads. That's the one thing. And best part is when to avoid crowded places. That's my best part. Best advice would be avoid this crowd. Don't go to such places because you don't know who is positive, who is negative, and who is spreading the virus by being asymptomatic. And my approach to patient is almost similar. It's not much change is there, and is only the what you should say, just procedures like particle generating procedures. We are avoiding now as much as possible. Only whenever there is emergency, we are doing it with a full PPE in the COVID OT only, not routine OT.
For both of you doctors, some part of the time when you are interacting with some of you of the doctors, like they've turned positive even though they are asymptomatic. After they recover, your next repeat RT-PCR came negative. But they feel some people will be like, I don't want to work anymore. I don't want to see. I don't want to get into the again the same problem. Like how you people approach, Dr. Vijay.
Sir, my worry is this COVID situation. Since it's a pandemic, it's been create havoc. It's a havoc is being created in the minds of the people by the whatever the media or the this one, by the message to share. And one more second thing is one more thing you message in some media. It's just like a common cold. It will come and it will go. And only few people, only some 2 or 3% of people who need hospitalization, who need ventilation or who need hospital support, those people with a lot of comorbidities need to worry a lot. Otherwise, normal people like routine people like we, you need not worry a lot. It will come, it will go. Though you may be symptomatic for a few days, it's not going to cause any major problem to any of you. 98, 97 to 98% of people will be normal after the COVID attack also, if it becomes positive. And it will go off normally, just like a normal cold and flu. So don't worry about this. That's my message with you.
Dr. Bharti, like as I told, few doctors doesn't want to go back to work. Like how was your approach?
Definitely, that is not an answer, as Dr. Vijay, as professionally and duty bound, and we are working properly. Take an extra precautions. That's all it is required. It's more of a physical and mental immunity what you require. So get it that from proper way of doing the practices, or as I told previously. So just be jovial and just be happy, and you got an opportunity to serve in such situation because we are already exposed to such kind of situations. But it is just another pandemic. It goes off in a few months. That's it.
Dr. Vijay,
Yes, sir.
do you want to using this as a modality? You want to give any positive message to your colleagues?
Yes, sir. One thing is, now few things I would suggest, sir. First thing is that keep good practices in your daily routine. Daily 1 hour or 2 hour of yoga, exercises, like spending family time with family, ample time with the family, and taking good care while seeing the patients or examining patients. Though in these situations, especially ENT and dental and other practices should be minimized as far as possible. Others with good precautions like masks and shields, even the regulatory masks are also available. Those with those things, definitely this is be approached. But with the current scenario, current guidelines by the government and the concerned authorities, whatever the recommendations are being given every now and then, that should be followed strictly and obediently, and that will make our life more easier. And even I should tell some symptoms like even I had after I was admitted to a hospital, I had definitely severe headache for a few days. I approached one of my seniors, and he told, Vijay, don't worry, just do some exercise whenever possible in the whatever the place is available to you. I started doing as a routine practice just few walks for a 10-15 minutes. The headache got disappeared. Even the strong medicines also couldn't help me anything with that headache. This small exercise of 10-15 minutes, just simple walking for 15-20 minutes, that relieved me of the headache. Even after coming home also, I started practicing yoga. Even though I was practicing earlier, I left it in between for some reasons. So I started again with the practice of yoga nearly in the morning for nearly 1 hour. I now with my wife also I continue to practice yoga and pranayama, and we are doing the mental health status, the emotional health status is really well, and we are approaching these things very much in the positive manner and not affected by these rumors or the media spreads of the false news or the alarming news, etc. And that positive approaches by doing yoga practices, pranayama sessions, and these healing sessions are definitely helping keeping this pandemic away from us.
Dr. Bharti?
Yes. Okay, the positive message what I want to give for my dear friends, to the general public, that don't become panic. That is the first thing, because the fear is the most important thing which makes our immunity low. So be courageous, be positive, as Dr. Vijay told. Have good practice guidelines. So as a professionalist, take care what you are supposed to take care as per the government recommendations, and properly follow yoga, meditation, prayers. Yes, prayers are very important, which will give us, and of course, the inner strength to, because it's the period during which you can't talk to, you can just talk to do all these practices, and of course you take care of your family by additionally allowing them to practice along with you. That makes a lot of difference, Dr. Sharad.
So, in the journey of COVID, for everybody, the yoga, the breathing techniques, positive attitudes to the life, the prayers, helping others, the few people to come out of the journey. That's what I understood from all the talkings.
Yes,
Thank you, doctors. Thank you for being with us for this session of interaction. Thank you.
thank you, Unnati Healing Foundation and Dr. Sasidevan for giving us this opportunity. Thank you, sir.
Thank you so much. Thank you for Unnati Healing Foundation and Dr. Saraswati ma'am for this opportunity to share our experience with our own COVID warriors. Thank you.
Thank you.
Hi, I'm a postgraduate medical student who was tested positive recently for COVID 19. I had lot of fear during this period about myself and my family because of the widespread news about corona in the TV news channels in the social media. I had heard about other modalities to build our mental and emotional fitness to deal with COVID crisis. As a medical graduate, I had a lot of inhibitions in trying any of these practices at this juncture as a COVID positive patient. I did not have much options, so I decided to go ahead and try one of them. After all, I won't be losing anything. I attended one of Unnati's Healing Foundation's online session on self-healing during this period, which focused mainly on breathing exercises, meditation, simple physical exercises, information about panchakoshas, techniques to heal oneself. To my surprise, it gave a lot of support to come out of fear and anxiety. This session also helped me a lot to face this with courage, strength, and with relaxed mind. Thank you, Unnati, for such session and timely support. Thank you very much.
Hi everyone, I am a postgraduate medical student who tested recently COVID positive. I was going through lot of fear, anxiety and stress during this period about my disease status as I was symptomatic and was thinking all possible worst complications. Added to this was the news from the TV channels and also social media. I was also worried about my family too. At this crisis situation, I got an opportunity to attend a relaxation and self-healing session organized by Unnati Healing Foundation. Practical sessions and the information shared in that helped me a lot to come out of my crisis easily. And now I'm working with more positively with our patients and counseling them more positive attitude. Thank you, Unnati.